Massage therapists are considered healthcare providers. So we're super liable. We have all of this ability within our scope, and I feel like we're underutilized. Not everyone realizes there are some of us out there that are utilized. We're in that same toolkit as these other holistic practitioners. It was a lot of the more spa, relaxation, that kind of thing. It wasn't people willing to address like, this is my point of pain, help me figure out what's causing it, what can I do to prevent it? And that is how my practice is molded.
Today, Kayla breaks down the clinical side of massage most people have never even heard about, from injury recovery to real structural change, and why more people should be using massage as a preventative care. Let's dive in, and this is Florida Unscripted. All right, Kayla, tell us a little bit about what you do and how you got started in your industry.
So I'm a licensed massage therapist with the state of Florida. I'm also certified in manual lymph drainage, and I'm a certified modern cupping therapeutic practitioner. I got into this role after 12-ish years of chiropractic assisting and working with some big name spine surgeons in pain management.
Oh, wow. Yeah. That's like a big, that's kind of it kind of all goes together though.
Yeah, totally. Yeah. It's seeing both sides of the coin for sure. It really has helped me a lot once I transitioned over to massage therapy.
So when did you make that transition?
2 years ago.
How did that process really look per se? Like, did you just get licensed with massage therapy and then the other ones, or how does that work?
So I didn't do any licensure. It's not very common to do licensure as a chiropractic assistant, but I did do so many years with it and worked under so many incredible doctors and learned the whole time, to where I was, there for exams. I was doing some, cupping or KT taping, really helping to assess patients. All of that work was injury work. So a lot of car accidents, which is a big thing in Florida. And then, you have your slip and falls. Then you have your people who just, did not have a lucky day and had an injury and were coming in looking for some pain relief. Through doing that, I just built this knowledge base and realized how much comes from muscles, and decided that I would really love to work autonomously. And as a massage therapist, that's what you can do. So I decided to pursue becoming a massage therapist so I could open my own business.
Did you go straight from licensure with massage therapy to opening your own practice, or did you work?
Did.
Oh, you did. Okay.
Right into it. Yeah.
Okay. So
I was ready.
So how was that?
It was really fun. I had helped launch a couple chiropractic clinics, and as an assistant, my last couple roles with chiropractic, I was also doing the administrative side. So I really learned a lot on the scheduling, so different billing things, even attorney stuff, different aspects that normally a chiropractic assistant wouldn't get under their belt. And through doing that, when I was getting closer to the end of my education as a massage therapist, I realized I've got this in the bag. I can totally do this. And it was really, there wasn't a lack of confidence in running a business. It was that imposter syndrome of can I actually make a difference with the hands-on? And I did, and it's been going very well.
Well, that's really good. What do you think's been the biggest challenge that you faced so far since you started?
It's got to be the self-talk portion.
Okay.
Being totally transparent. Sometimes, you have days where you're wait, am I making a difference? Is this person, they're not just flattering me saying, oh my gosh, thank you, I feel so much better. You have to really be able to say, no, I am capable. I do have the knowledge and I can make change. And you got to just push yourself.
To just be it's okay. I'm just gonna do it, which I definitely get that. I mean, as being a small business owner myself, being in real estate, there was a long period of time where I was I felt like I wasn't gonna make any ground and I wasn't gonna get through it. But then, it's kind of that season of, I don't know, difficulty where you don't really have that many people coming in. It's the start,
Yeah.
Was it did you find yourself having a lot of patients in the beginning because you had so many connections with chiropractors, or were they not friendly to you branching off?
So they were my biggest supporters.
Well, that's really good.
They were so happy for me. Of course, my husband was a huge support. He's also a chiropractor.
Oh, okay.
I did not work with him before I married him. So there was a lot of, chitter chatter, Kayla's going to be a massage therapist. Kayla's going to be a massage therapist. And before I opened my practice, I actually had a list of 30 people that were when you're good, when you've got your inspection done and you're allowed, please call me. So it was about 3 weeks weeks into opening, I was booked out 3 months already. And
Wow.
people were just referring because there wasn't a lot of clinical massage therapy in the area, which I started in Zephyr Hills. It was a lot of the more spa, relaxation, that kind of thing. It wasn't people willing to address, like, this is my point of pain. Help me figure out what's causing it. What can I do to prevent it? And that is how my practice is molded.
Okay, yeah, no, I think that's super interesting. And like I agree, like a lot of people don't really do much clinical massage. Or like people don't assume massage therapy with anything clinical or like actually like preventive care almost in a sense.
Right.
They just view it as like enjoyment.
Yes, and that's kind of like a frustration point for me because in the state of Florida, massage therapists are considered healthcare providers. So we're super liable. We have all of this ability within our scope, and I feel like we're underutilized because we have the reputation for the spa and the stones and the hot towels and this like blissful, I have extra money, let me go do this. We're not always put in the same category as holistic care, like someone who wants to go to chiropractic or go to acupuncture or PT. Not everyone realizes there are some of us out there that are utilized. We're in that same toolkit as these other holistic practitioners.
I actually didn't know that. That's pretty interesting that you guys are viewed that way. I think that view is changing. I think more and more people like that are younger kind of know that there are two sides to
Absolutely.
massage. Like
Yeah.
like there is an enjoyment side, but there's also like an important side. Like my mom used to go to a massage therapist for like back pain and like pulled muscles and things like that. Like was more like on that clinical side of
Yeah.
prevention. I don't every time I've ever gotten her a massage for pleasure, she's never went. So
Oh, really?
I'm like, why do I spend money on you? She's like, I would like a really nice like luxury massage. Okay, mom, I'll buy you
Yeah.
that. Never does it.
Yeah.
Like, why I waste my money? But no, I do think it's important, especially because I know your office is in Lady Lake too, right? Like you're here and in Lady Lake.
Yeah, Lady Lake and Bushnell.
Okay, and there's a lot of older people around.
Everywhere.
Yeah, I know.
It's a really good mix, though. I was a little like, oh man, am I going to see mostly of that like 55 plus? But I have a really great blend and incredible patients in both locations.
Well, no, that's really good. I could see where it'd be really beneficial to those that are older just because it would help keep you looser and like more likely to prevent, falls or, maybe actually pulling those muscles or things like that just because it allows you to be, have the ability to have some more mobility, I guess I should say.
Yeah, we definitely work on range of motion with people if they need it. A lot of times we identify weaknesses in certain muscle groups. So maybe someone is super strong on those like anterior muscles, right? Because everything we do is in front of us. We're driving, we're typing, we're on the phone, whatever it may be. But a really like a truly balanced body is twice as strong in the back posterior than it is in the front. So it's really interesting when I have patients who are just so dedicated to the care and they are doing like systemic care. So we've got like I'm handling muscles and some range of motion mobility. They've got a chiropractor, maybe they're integrating acupuncture, and then we're saying let's do some pull aparts, let's strengthen the back, and you'll just see their whole posture starts changing because they're balancing out their strength, which in turn is going to reduce the pain or the dysfunction because maybe the dysfunction was coming from like that kyphotic posture, and now we've got them up, maybe not perfect because they've been going this direction for however many years, but we're taking more and more tension out of the equation by correcting some of the daily movement.
Yeah, no, I definitely think that is important. I mean, even I deal with that. I mean, I'm constantly on the computer, constantly having to do that. It's just part of my job.
It's hard.
It sucks, but it's
Yeah.
just kind of part of like our day to day.
Absolutely.
You mentioned like pull aparts. What is that?
So pull apart is when you have a resistance band normally, and you're just kind of creating that
Okay.
table in front of you and pulling the band and really squeezing the shoulder blades or scapula together just to kind of get rhomboids and levators a little more activated. And by strengthening those muscles, it kind of naturally will bring you back into this more upright. One thing that I do work with my patients is making sure that the pec muscles up here and, hyoids in the front of the throat are also released, because if they're really stuck from us being forward, they're not super willing to open while we're creating strength in the back. So we loosen these, we get these tighter, and then we balance back out.
Yeah, no, I think that's super important. It was something interesting because you were like talking about like the impact on the face. And I was watching, I don't know, a TikTok or something talking about the importance of like your jaw and like your like posture of your jaw and all of that stuff and how that can actually like affect the other parts of your body.
Yes.
And so I know you do TMJ and like intraoral like massage therapy, which I thought was super interesting.
I do.
Which I think I've never seen that before. So
Yeah.
like, I was like, oh, that's different. So could you like explain like if somebody was to come to you for that, what that would look like.
Yeah. So my intraoral care is about 90 minutes treatment.
Okay.
It is something that you do specialized training in. So this isn't something that we just learn in school. I trained with a company called Spa Ninjas, which I'm actually working towards teaching with them now. And I've traveled all over the country helping to teach intraoral. But so what we'll do is we start with the neck, the posterior side of the neck, and we make sure that's very loose and we have some great blood flow. And then we move toward the front of the neck and we actually manipulate the trachea. It's very flexible for most people, but we'll manipulate it just barely to the side and work on the hyoid muscles that kind of run on that anterior aspect of the spine. And then we're able to work up into the suprahyoid muscles. So we release that, we've unwound the back of the neck. Then we start kind of palpating the sternum here and just making sure that costal muscles are sitting nice and pretty, not having any of that like raised or inflamed kind of feeling. We can kind of tuck them back in. It's a little bitey, but it only lasts a few seconds truly. After we've done that, we start working the outside of the face, massaging with like really nice, like I use organic jojoba oil. I also have like specialty massage lotions for the face. So we're not like oiling people up and, creating issue there. But we'll go like around zygomatic arch and we're getting like the outsides here around the masters, pterygoids, and then sinus and things like that. And then once that's just all like super loose, happy, we'll use a hot towel, make sure everything's off the face, reapply some clean jojoba oil, and then put on gloves. And we work with our hand inside the cheek and we'll actually hold the muscles from both sides and help to lengthen them, address any trigger points that are in the face, which are super common. And we're also able to kind of like strip a little bit of sinus working up in here. I've done some suprahyoid work where I work behind the teeth just a little bit. So we like match fingers, one's inside, one's outside, and start loosening that. And we really just try and get the temporomandibular joint to have good movement because the attaching muscles like temporal muscles and everything are loosened back up, and people get incredible relief from like ear fullness, sinus problems, snoring, TMJ. Like TMJ is never at the top of my list with intraoral work. It's like, migraines, lower back pain can be affected in a very positive way by bringing jaw back into, a happy place. It does align it a little bit, but it's a pretty cool modality to offer. We're going to have a class in February, and hopefully I can get a few more massage therapists in the area trained in it so that there's not as much of a wait list to have it done at Key Health.
Yeah, no, I think it's super awesome because I myself like deal with like some issues with that. Like I ended up like in something that happened when I was in college, and I ended up getting like hit in the face with something, and it like really messed up like my jaw. Like I couldn't open it for a long time, and then eventually I was able to. But I've always had issues with it, and ever since then.
Yeah.
And so like when I was like this is interesting. Like I want to know about this.
Yeah.
Because it could benefit me, but I also think it's interesting too, just because it's not something that I've seen. Because I've talked to other massage therapists before, but I've never seen that. So.
Yeah. So you may hear like buccal massage or buccal massage.
Okay.
That's kind of like some swiping. They do a little bit with the jaw, and people do ask like, do you do buccal massage? I'm like, this is not that. This is truly like lateral pterygoids, masseter, buccinator, going for sinus, suprahyoid, hyoids, neck. Like we are resetting things. We can even do sacral reset. Like that's part of the training. So we can kind of work a few key like body postures, and then we just do everything like collarbones up. So it's definitely a lot more than like a buccal or buccal massage.
Which is interesting. Why don't you think a lot of people do it?
I think that people are intimidated sticking their hand in someone's mouth.
I guess that's probably true.
I've only been bit once and it didn't break my glove, and that's all that mattered to me. I think that there's a lack of understanding what is truly allowed within our scope. And in the state of Florida, we are absolutely allowed to do intraoral work if we are trained. Other states can be a little bit more gray area about it. So normally if I'm having students coming from other states, I'm helping them do a little research just to make sure that, the training they're getting is one that they can utilize. But I think it's just an intimidation factor. But like with the class that I'm doing, the actual like hands and mouth part is like 30%. Like really a lot of the change is making sure that things are ready to move and ready to soften. And then we use that 30% to just address with the cheek, and then we go back into face cupping and we drain the lymph, and then we do some gua sha. I do some red light. Like, we try and end on a very like bougie note.
A bougie note. That's very funny. Now I know you also do like lymph drainage too, right?
Yes, I'm certified in manual lymph drainage.
So you can tell us a little bit about that.
Yeah, so lymphatics is a really underappreciated body system. Lymphatic fluid in the body is kind of like the waste pickup. And what happens is it's supposed to be grabbing long chain fatty acids, bacteria, cancer cells, viruses, tattoo ink, like things that are too big to kind of go through the blood capillaries. And what happens is that there will be a trauma, or maybe your lifestyle isn't the most active, high stress, high tension in the muscles starts to slow the flow, and people can become stagnant. And people will notice, I have this tenderness in my armpit or where my legs meet my body, or I can feel a fullness, in my throat, in my jaw. And normally those are kind of little signs that things are backing up. So we will address the nodes. We do all of the major node areas in the body. We pump them, and then we are trained medically. My associate and I are both VODR trained. So we will go pathway through pathway in a very specific order, counting, using very specific, very light-handed techniques. And we actually manually start moving the lymph to the nodes where the nodes can dissolve the waste, and then take that clean lymph back and put it into the bloodstream where it actually belongs.
No, that's really cool. I think all these things are pretty interesting. It's just something different because I had some massage therapists that do like Reiki and like vibrating tables and stuff. So it's kind of interesting. It's like kind of its own little specialty in and of itself. So that's pretty interesting. I like hearing about like how like the different facets of like everybody's like of different career choices or like different facets. Like, massage therapy can be so wide. There's like other things that can be so wide.
For sure.
So it's like really, to me, it's like super interesting.
Yeah. And we have a frequency table in the Lady Lake Clinic. So we can set that on 30 hertz, which is really like the best vibration for lymph. So now you're like laying on this warmed vibrating table, getting full body lymph, dimly lit. We're casting the northern lights on the ceiling. There's the calm music. Like, it doesn't have to feel clinical,
Like, so you're bringing in that kind of like typical massage therapy thing.
It's pretty much like just take a nap. Like, you don't stand a chance.
So I want to talk a little bit about like what your goals are for the end of this year and the beginning of next year. I know you kind of talked about it a little bit and things that you want to do, but
yeah, so I really want to finish up with my training and become a teacher. That's something I would absolutely love to do. I love clinical massage, and I think that, there is a need for it. So it'd be great to really keep pushing massage therapists to kind of challenge themselves and really put in the time and work to learn the science. I eventually will onboard some more massage therapists. We have room right now probably for one more to rotate through. And then in a couple of years, I hope to be in a bigger building. But right now it's just kind of getting the word out, let people know that this is available to them. And we're doing our best to do that and network with other doctors and make sure that they're there for us and that we can utilize them when we do need to refer out.
Well, no, I think that's really awesome. So now, do you live here locally? Like, are you from the area? Or
I live in Middleton.
Okay.
Yeah.
Okay. That's not that far away.
Yeah, we just got here a year ago. My husband took a job at Compton Chiropractic, and we were able to come up to Middleton. And it's been really, really neat, kind of taking the business, moving the business, expanding the business. And I'm like, oh my goodness, it's all going so well. It's like, don't wait for the other shoe to drop. Just keep doing what you're doing. Keep loving people and helping them,
So where did you come from originally?
Zephyr Hills.
Oh, okay.
Yeah.
Okay. So it wasn't that far away.
It was so surreal because it was just this 9x14 room on the other side of a clinic, and I was renting it, and I blinked and I had Lady Lake, which is 1,500 square feet, 4 rooms. We have holistic esthetician, IV therapy, 2 massage therapy rooms. And then next thing I know, there's availability for Satellite Clinic in Bushnell. And I said, yeah, I'll do it. Let's do it. We can do this. And here we are.
Yeah, no, I think that's great. Now, are you from there? Like originally? Like
I was raised in Florida in the Wesley Chapel area.
Okay, no, that's awesome. I don't meet too many people that were like born here and still live here.
Yeah, we moved down when I was like 3. I guess I'm technically a Hoosier. I'm from Indiana.
Okay.
But I was very much raised in Florida.
Okay, yeah, no, I'm generationally from Florida. My grandmother lived here, yeah. So, but I still don't meet that many people that have like can say that they've lived here like pretty
Pretty
much
much my
a
whole
life.
life.
Yeah, like you don't really know much different.
Yeah.
Did you ever move out of the state?
Yeah, I lived in Alaska for a
Oh
few
gosh,
years. I lived
okay.
in the North Pole and in Fairbanks, and I lived in Kentucky for a little bit, and then got myself back down here and just kind of started anew, and
Yeah.
here we
What did you do in
are.
Alaska?
My first husband was in the Army,
Okay.
and so we were stationed up there, and it was a lot of fun.
Yeah, that's kind of fun. Yeah. Like Alaska's fairly cold.
Yeah, it was like, whoa, you go from Florida to Alaska,
Alaska.
that's a whole thing.
No, that's cool. But you know,
Yeah.
I actually don't, I know quite a few people that have done that though,
Yeah.
which I think is interesting that
Yeah,
we
I
go
moved up 10 days before the first snow, and I was like, well, go big or go
go home.
home. So
So, what are some things that you like to do when you're not, doing your day-to-day job here locally in the area?
So I love animals. I have 2 cats and 3 dogs. I'm fostering 3 kittens right now. So they're kind of, my happy place. I love gardening. I have a pretty big vegetable garden at my home, and then just little crafty, designy stuff when I have time and patience for it. But yeah, I really love just like taking some time outside and, growing the veggies and just having my little fuzzy buddies with me.
That sounds like fun. So, towards the end of my podcast, what I always ask everybody is if somebody's looking to do what you do, what would you tell them?
Yeah, just be ready to learn, to be able to open up your brain and understand that you're not going to understand right away, and that's okay. In any job, like you do your training and everything, but then when they actually put you out on the floor or, the real thing, it can be scary. And I think that it's really easy to just shy away versus reminding yourself like it's okay to not know right now. It's okay to tell your client or patient, like, give me a few days, let me research, let me look into things, let me talk to my network and see, because I see a lot of people with disease. I do a lot of injury, chronic pain, rods in the back, replaced joints, all kinds of stuff. That's my niche, is like, let's get
The
to
extreme things, kind
less
of.
hurt, and it happens. People come in and they're like, I have blah, blah, blah. And I'm like, cool, I'm going to need another day or two, and that's why I always push people to do their paperwork ahead of time so I have time. But you're going to be in school and maybe you're acing all your tests and everything like that. But I can tell you the first time I gave a massage, licensed, ready to go, I was vibrating worse than my table. I was so scared and I was like, what am I doing? And then, you'll settle in, and then it's your decision at that point. Do I want to learn more? Do I want to lean clinic? Do I want to lean spa? Do I want to do lymph only? Do I want to do, integrate energy work or something like that? And you're just going to find yourself slowly but surely, like, it's going to happen. And it's such a rewarding path to be on. I can't recommend it more, honestly.
No, I think that's really awesome. So, if somebody wanted to book with you, what do they have to do that with you?
So they can go to our website, keyhealthandwellnessfl.com. They can also give us a call or text at our business number, and I'm happy to kind of help them set up or decide what might be the best treatment for them. A lot of people have questions before they pick the treatment that they want with myself or my associate, but we're happy to answer those questions before booking.
All right, awesome. Is there anything that you want to add before we wrap up?
Probably on the note of lymph, like,
Sure.
it doesn't have to be pre-op or post-op. Lymphatics is good for everything. If you have, autoimmunity or an inflammatory disease like fibro, lupus, things like that, it's actually really, really beneficial for those kinds of things. There's a lot of research coming out for migraines and lymphatics.
Interesting.
So we've been and we, as my associate and I, we follow those things, and we're, ready to work with people and learn with people. But even people who are, lipedema or lymphedema, like, they can benefit from having that and getting that swelling off and getting, things moving. Or if you have no swelling, we're still going to be boosting your immune system because we're cleaning your waste station. So it's really beneficial to way more people than they think. It's not just, I have a lymphatic disease or I have XYZ. It really can be maintenancey. It can be boosting. People who have suffered with like long COVID, or they've suffered with, I had the flu and I just don't feel like myself and it's been 2 months. I can't shake this fatigue. I can't shake. Sometimes it comes back to lymph. And unfortunately, a lot of doctors don't go straight for, oh, maybe you need your lymph, one over. Maybe we need to do some lymph drainage. But the people who come in and get it done, it's like,
a
Oh my
big difference.
gosh, yeah, we do a couple of rounds and they're like, "Yep, I definitely can tell. Like I was very stagnant. I'm feeling so much better now." So, we just want people to know that that's available too and it's very gentle. So, if it's someone can't handle pressure or they're having a lot of pain, lymph is like our easiest approach and it has huge impacts on everyone.
All right, awesome. Well, I think that's it. Is there anything, like I said, is that it?
No,
No,
that's
that's it.
it.
All
Thank
right.
you.
You're very welcome. All right, guys. So I hope you enjoyed this awesome, great episode. Look back next week for another great episode.